Hello everyone, welcome to our YouTube channel Logic Medico. If you are new to our channel, kindly consider subscribing and don't forget to press the bell button for the latest notification of videos. Today's interesting topic is Pectoralis major. So what is this Pectoralis major? Where exactly it is present? See, pectus means chest or the breast area. So it is present in the front portion of the chest. It is present over here. That is, and it is a large muscle. Therefore, it's called as major. So that is pectoralis major. So any muscle we should be able to explain under the following heading. What is the location? Just now I told you what is the location. Pectoral region. Then origin, from where it begins. Then insertion, where it ends or where it gets attached. Then nerve supply. Last but not the least, action. Actions. So these are the headings. We'll see one by one with a diagrammatic explanation. See, this pectoralis major is a muscle in the front of the chest. So in the front of the chest we have this bone called as sternum, and we have this one more bone called as clavicle. So that is the origin, from the sternum, clavicle, and from the ribs. So how many ribs? Upper 6 ribs, from first rib to 6th rib. So from the clavicle it takes origin from the anterior surface. Why anterior surface? Because this is muscle in the anterior chest wall, so it should be anterior surface of the medial half of the clavicle. Medial half of the clavicle. From the sternum also it is on the anterior surface close to its lateral border. From the rib it is first to 6th rib. First to 6th rib. It's called the sternocostal fibers. Now coming to the insertion, they go to this bone called as humerus. Now humerus has got one groove here. It's called as intertubercular sulcus. So this muscle goes to the lateral lip of the intertubercular sulcus. The sternocostal fibers will go higher and the clavicular fibers will go lower like this. So they are going to flip across one another. So that is about the insertion. Coming to the nerve supply in the pectoral, in the chest area, in the pectoral area, there will be two nerves. Okay, one on the medial side, the other one on the lateral side. So medial side we call it as medial pectoral nerve. Lateral side we call it as lateral pectoral nerve. So medial pectoral nerve and lateral pectoral nerve is the nerve supply of the pectoralis major. Medial pectoral nerve arises from medial cord. Lateral pectoral nerve arises from lateral cord. Now what is the action of this muscle? The action of this muscle is, since it's crossing the front surface of the shoulder joint, it will cause flexion of the shoulder joint. Flexion, especially the clavicular fibers. On further contraction of the sternocostal fibers, the entire arm will be moving medially, and that action is called as adduction of the shoulder joint. Further, other than flexion and adduction, upon further contraction of the muscle, the upper limb is going to rotate like this, and this rotation is called as medial rotation. So I'll tell you one more time. The action of pectoralis major is flexion of the shoulder joint, adduction of the shoulder joint, and medial rotation of the shoulder joint. So these are the three actions possible of the pectoralis major. Coming to the clinical importance, congenital absence of the pectoralis major is called as Poland's syndrome. That's an interesting applied anatomy of the clinical relevance, wherein on one side the pectoralis major is present, whereas on the other side it is absent. One side muscle will be there, other side it is not there. That is called as Poland syndrome, in which the chest deformity, it appears like as though there is a deformity in the chest. So that is the importance of knowing pectoralis major. Hope you like this video. Consider subscribing to our channel and pressing the bell button for the latest notification of the videos. Thank you for watching and learning from Logic Medico.